Everybody for joining again. We just had, I think this is our 5th session, last day of Startup Week, and the second to last session specifically on health tech. And today right now we have Don Wright, CEO of Clarigent Health, and Scott Roth, CTO of Hive Networks. They're going to talk about building a digital health company. So we talked about a drug therapeutics earlier. We've talked about some devices, and so now digital health. So I'm not going to steal Don's thunder, but Clarigent is bringing science to mental health, and they also recently released its product Clarity. So we'll hear more about that. Hive Networks is also sort of bringing science and sort of the use of community to support better health outcomes, and they have a platform to help peer-to-peer innovation. So let us kick off with both of you guys, just going quickly. What is it? What is Clarigent? What is Hive Networks, and where did the research originate, and how do you build business around it?
No, Scott, you go. For those of you who know or who heard the kind of pre-game here, Scott and I have been working together for what, 25 years or something?
25 years, yeah. Bulk of my career has been with Don, and it's been a pleasure, and I'm very grateful for working in a lot of his organizations over the years. So, yeah, so I'll go ahead and
I said he could talk.
What's that?
I said Scott was shocked when I said he could talk.
Yeah, I was a little shocked. So in terms of Hive Networks, Hive Networks basically is a technology company formed around a spin out of Cincinnati Children's Hospital. What Cincinnati Children's Hospital created was something called a Learning Health Network. And a Learning Health Network is a tri-party improvement community that brings patients and families, clinicians and their teams, and researchers and their teams on a level playing field to work really closely together on these quality improvement teams to improve the quality of life and quality of care for patients with rare and chronic conditions. So the Anderson Center formed over a dozen of these over the past 10 plus years, and they showed significant impact on following these methodologies of quality improvement. So, for example, there's a learning network called Improve Care Now that has a 22% increase in remission across the entire IBD population, so irritable bowel syndrome, Crohn's disease, of the patients in their network. So with the innovation, the collaboration, the quality improvement methodology they've shown, these communities working together, they keep showing incredible improvement of quality. Another example, the National Pediatric Cardiology Quality Improvement Collaborative, NPC-QIC, is the first multi-center learning network with pediatric cardiology. They were able to reduce mortality for children born with a univentricle or half a heart by 40%. So significant innovation and improvements in the quality of care and impact on these people with these patients with rare and chronic conditions. But they're just scratching the surface, touching the tip of the iceberg with these learning networks. They formed 10 to 12 of these, as I mentioned, in pediatrics, but there's obviously thousands of rare and chronic conditions in pediatrics and adult care. So in terms of how Hive fits in that, a lot of these processes they've followed have been done without technology or pieces of technology. A lot of manual processes, a lot of meeting in person, and a lot of just piecemealing things together. The Hive platform is a centralized platform to bring this all together. So an improvement community, a safe and private online community where patients and families can collaborate with the clinicians and their teams and the researchers and their teams. And one thing that we strongly have a stance on is Hive does not own that data. The communities own that data. So it's a private place that they can feel comfortable sharing their day-to-day problems, their day-to-day solutions. And in addition to that community, these methodologies that I talked about that have come out of Institute of Healthcare Improvement have come out of the Anderson Center of Cincinnati Children's. We have a centralized platform to walk not only the most novice, but the most advanced people to follow these methodologies to quickly create innovation, quickly create improvement. And on top of that, we've tied in the patient registries, the data of these patients, the day-to-day patient reported outcomes. So we know what's happening to these patients between doctor visits. So we have rich data getting to these researchers and these teams to improve the quality of people with rare and chronic conditions. And I can go on for the next 2 hours talking about that, but I'm going to give Don some time.
Yeah. You can talk. That's probably the most I've heard you talk when I was in the ring. That was a great description of Hive. That's probably the best description of Hive that I've ever heard.
Get that done.
So Clarigent Health. So we also came out of Cincinnati Children's, technology created in John Peshtian's lab there. John was one of the inventors also of the company that Scott and I were previously at AssureX Health.
Mm-hmm.
And actually we worked with this technology back when we were at AssureX Health. So even though the company is only about 3 years old, we've actually been around this technology for about 9 years. And the technology has been under research for in between 15 and 20 years. First papers came out about 15 years ago. So what we do is we are able to listen in on a conversation, so between a therapist and a patient. And our technology can basically, using different characteristics found through AI and machine learning on over now almost 2,000 samples, and I forget the number exactly, but 25,000 minutes of speech, we are able to basically figure out if somebody is suicidal, if somebody what level of depression they're at, what level of anxiety. We're working on traumatizations, so things like PTSD. And then in the future, looking at things like dementia, finding out that someone's moving towards stroke, and getting them to a healthcare center before it happens. So we, as Carl said earlier, we just released our first commercial version of our product. We have 4 successful clinical trials where we have shown the ability to do this both in a hospital setting and in a school setting. And we now have built a back-end system that we call it the dashboard internally, but it's much more than that. It allows you to take an individual and look at them over time and build look at for alerts that they're moving in the wrong direction or the right direction with their therapy. But it also lets administrators and supervisors kind of pull up and look at things like, how's the entire school district doing? How are particular schools within a school district doing? How are 4th graders doing versus 5th graders? If you're a group practice, how are my female patients doing compared to my male patients, or however you want to categorize things from a public health perspective. Ohio Medicaid or somebody like that could look at how different counties are doing. So really trying to put kind of all the features around it that make it into a commercial product instead of just the technology that is so important for watching for, especially right now, suicide and crisis. If I can throw out a couple of quick stats that are super alarming and people should be aware of. The standard in the United States is 1 in 5 people in the United States have a mental health condition that affects their school, their work, or their or basically their lives, their relationships with their families. Right now, CDC is saying that number is 1 in 2 during the pandemic. CDC is saying that 25% of adults have considered suicide in the last 6 months. And actually a study, if you don't know, 12 to 34-year-old people, suicide is the second leading cause of death behind accidents. And that's just been true for a while. Right now, that same age group is saying that 50% of those people have considered suicide in the last 6 months. So, there's a huge need for ways to find those people. All of those stats, even before COVID, there were not enough people in the United States, not enough resources, and enough professionals trained in mental health. And so now we've doubled, tripled, or quadrupled the need with adding no more resources. So technology is going to have to help with these things.
So
your technology is so needed. You talked about the statistics there, but in our previous world at AssureX Health, we know better than most the need for help in the mental health world. And the product you have is just incredible, and I look forward to seeing success.
Yeah, in an earlier session, I mentioned how I don't think there's anybody here that's not had a loved one affected by cancer, and I think mental health is probably maybe even more so, right?
Yeah.
So,
Well, in the age group that I talked about earlier, that group where it's second leading cause of death, more people in that age group die from suicide than cancer, cardiac, um, and whatever the next two are on that list combined, right? So, and I think that you know, any of the stats I could obviously, just like Scott said, I mean, I could sit here all day and talk about the stats, but I think there's some telling things out there when we argue as a society about numerous things like handgun control and things like that, right? So about 40,000 people a year in the United States die from handguns. 2/3 of those are suicides every year, not homicides like people think. So, when we talk about that problem, even though obviously homicides and, if we're going to fight about white police officers killing unarmed black men, or black men killing black men, or all those types of things, we also need to take a step back and say, well, 2/3 of those handgun deaths were suicides. So maybe when we're arguing about gun control, we're arguing about kind of the wrong problem at times, right? That there's other things we need to do around handgun control, like force gun safes and force trigger locks and things like that, because it's means that actually cause these things to happen, right?
So I know that, so Eric put a broader question there that I'm going to get to, but first, before we do that, focusing on your two companies again. Clarigent is about 3 years old. Hive Network is about a year old. Scott, am I right there?
Just two. Yep.
Okay. So, what is your sort of definition of success? What success look like for your companies, and then what is the pathway to get there? What are sort of the milestones you reach, and what does that look like?
You want me to go, John?
Yeah, sure.
Yeah, cool. So our pathway to success is to work with the Institute of Healthcare Improvement, to work with the Anderson Center at Cincinnati Children's, and all of these folks that are mission-driven and passionate leaders that want to make a difference in the rare and chronic condition or the situation that they're trying to solve. So we were just talking about mental health. Having communities on mental health that patients, their families, and everybody are collaborating to figure out these issues, day-to-day issues, not the cure, the long-term cure, but day-to-day issues of identifying to spread knowledge, et cetera. The success to me is spinning up thousands upon thousands of these communities for the different rare and chronic conditions, because bringing in this entire community is going to bring in better innovation. It's going to bring in richer data to speed up that innovation. It's going to bring in ideas that researchers aren't going to think of because it's coming from the patients that are living from it day to day. So success to me is thousands upon thousands of these learning health networks and improvement communities working together. And honestly, the more we create these there's comorbidities across all of these rare and chronic conditions. Some with cancer, there's a high comorbidity of mental health issues. So these communities working together to solve problems is just going to better the lives of these people that are dealing with this day to day. So success is thousands upon thousands of these networks.
Yeah. So from a Clarigent standpoint, like we said earlier, we just went commercial. We're in the process of signing our first commercial contract. So we're converting customers who were in pilots or knew about us from clinical trials and those types of things into customers that actually pay, which I guess is probably the definition of a customer, right? But which is good. Obviously, if you think about like the mechanics of how do you keep a startup alive, you've got to either have a lot of revenue or you've got to have enough revenue to convince investors that you're going to have more revenue later, right? So getting that first revenue and showing that it can be integrated into the workflow of our customers and that they'll continue to pay for the product, right? So recurring revenue is really where we are from a kind of the mechanics of success, right? But from a mission success, it's really about showing and starting to get widespread use of it, like Scott was saying about Hive, but also starting to see that it's actually making a difference in those situations, right? So if I think about AssureX, I used to always use the example. I still use it. I used it yesterday on a talk that I knew that I was going to keep working in healthcare technology when a mom called me at Assurex and said that her daughter had gotten our test 3 weeks ago, and she's 9 years old. And that morning, she had heard her daughter laugh for the first time in her life, right? So, and so, if you can make those kind of changes in people's lives, then and you can also make some money for your investors, then life is great, right? We are starting to see a little bit of that, albeit in clinical trials. So it's a little weirder. You have to kind of extract it out of it. But we have an example recently with one of our clinical trial participants where the therapist was blinded to what we were seeing in the patient, and so for a 3-week period, the patient was saying that they had no suicidal thoughts whatsoever, and they were even doing Columbia's and other scales because they were in our trial, and basically the patient was just lying, right? And so in the third or fourth time that the therapist met with the patient, our probes, according to the therapist, the questions we tell them to ask actually got the child. In this case, the child was being seen for ADHD and some other impulsive problems. The child actually said, okay, I've been lying. I've been thinking about harming myself or killing myself. And they did the Columbia and the other things. And, and so you watch the charts and it spikes up to a high level of, even the therapist was then saying that there was a high level. So we would have seen that, 3 weeks earlier, or however, however many appointments there were. And when we unblinded it to the therapist after the clinical trial, they said, oh my gosh, well, right. So I would have known to dig in, 3 weeks earlier. And thank God in this case, it's a tough thing with us, specifically when we're talking about the suicide prevention product, because obviously you never want a situation where you can say, well, we saw it before the person acted.
Yeah.
But we saw it and we figured out that the kid was lying, which is pretty good, right? So, hopefully we'll get enough use as we push this out across the country. We're starting to get some use around in Washington State and Minnesota and North Carolina, that we'll start to have more of those stories too.
So moving to a few, I think, some broader questions. Start with what Eric asked, and going back to your guys' history here together and in Cincinnati. So he's curious in your thoughts about recycling entrepreneurs and what that signals about the health of an ecosystem, and why did you guys want to take another at bat instead of just sailing on?
I can talk about that.
There's a lot of metaphors there.
There's so many layers to this. So, for me, I love solving problems. I'm a problem solver. That's my passion. And honestly, when I joined Assurex Health, and I really found my passion in the world of healthcare, really helping people and building teams to help people. And honestly, I don't see myself doing anything different for the rest of my days. Bringing the technology knowledge I have and the teams I have, and bringing that to help other people out. I want to keep this thing going. And honestly, bringing people into the way that Don has taught me and others have taught me to build companies and technology. I want others to learn that way, because we're very successful at Assurex Health. We're going to be very successful at Hive. Don's going to be very successful at Clarigent. And the more people we bring on to that type of way to build technology to solve and help people's day-to-day lives, that's my passion. That's why I continue to do this. That's why even after Hive, I'm going to do something else like this. It's going to be in the world of healthcare in Cincinnati. And hopefully some of the people I bring in my team, they go in different threads and they start doing their own. So we start building up that momentum, because we've got Cincinnati Children's here. We've got UC. We've got Ohio State up the street. We've got all these great universities with great research and technology that they need people like Don and I and many others in this ecosystem that know how to commercialize and build enterprise scalable software and to solve these problems. So that's why I don't sail on. I love this. This is my passion. This is my mission. And I hope that's the mission and passion of many others like Don.
So I don't know if Eric asked the question for this reason or if he even remembers this, but my panel last year on that Cincy Startup was basically recycling entrepreneurs and why we did it the next time and all that. So if you still have that somewhere, we could replay that whole panel. And
I'll go find the recording and save you the time. Right?
Peg was Peg was asking the questions for that. But I think if you talk just about ecosystem and those types of things, I think that the only real way you can have centrifuge with Eric, you can have Cincy Tech, you can have all the resources around, which I think Cincinnati and Ohio, but Cincinnati in particular now has. I mean, obviously there can always be more, but my gosh, when we started AssureX, Cincy Tech was just rebooting. Centrifuge didn't exist yet. The other VCs in town were all shutting down. They were just running out their final portfolio. And so it was really hard, not just from a money standpoint, but from a resource standpoint, like the amazing things that are available through Cincy Tech. But you can have all those things, but you've got to start having success with some of the companies in order for that ecosystem to grow, right? Ecosystems grow because AssureX is successful. Don takes some of the money he gets from it, starts another company, or puts it into other companies like Include Health and other things like that, sits on boards. People who worked for Don go off and become the leaders of 5 other companies, and those 5 companies do exactly what Scott just said. The people working for Scott then go off and build companies, and all of a sudden, by gosh, you've got 30, 40, 50 companies. I mean, we laugh about it all the time, but I think it's really important for people to understand that the first big breakfast was like 9 of us with 4 tables sitting up against the wall. And
for those that don't know, that's Cincy Tech's annual big breakfast.
Yeah, it now has 800 people or 900 people?
Breakfast.
So, and honestly, I remember when Carolyn was still at Cincy Tech before Peg and, now Byron, I remember at like the 4th or 5th big breakfast, all the stats that were up on the board while Mike Venerable was talking. And I was standing next to Carolyn and I looked at the number of jobs created. And I said, Carolyn, AssureX has created more jobs than that. What is it, negative jobs across all the other? Fake, right? And now you look at that and the companies that we're involved in are just a tiny little piece of the massive job growth, right? So all of a sudden we've got, this massive amount of great companies here, great startups and in all stages, right? Not just kind of that one, AssureX success. We've got dozens and dozens of great companies where you can look at them and say, well, all these companies are going to be successful, right? So that, and so coming back and doing it the next time, I mean, the beauty of that is that you don't, and this isn't just my second time, but you don't, some of the stuff that the guys who, and the men and women who work at my company get worried about right now, I tell them, things are much worse at AssureX at this point, right? So we're, so we try to not make the same mistakes. Well, we can make all new mistakes, but at least don't make the same mistakes that we made before. But I think that's the only way an ecosystem gets built is the short answer to Eric's question is you've got to have some success and those people have got to be willing to reinvest back in, whether it's dollars or whether it's, sweat equity or whatever, those people have to invest back in.
Absolutely.
So you guys are both doing, digital health companies, right? And so earlier we talked about some drug therapeutics, vaccines, medical devices, and then also Carol was sitting on infrastructure. What sort of makes the digital health sort of different process of building a company? And then what might you tell entrepreneurs, people who are technology minded, and they just heard Scott talk about changing people's lives, well, I can get in technology and think about that, right? But they're not going to be a scientist going to develop drugs. So what advice might you have them in this situation as well?
Well, I would say a few things about digital health. I mean, digital health has been around for a long time, as has telehealth. I remember when we were starting AssureX, Diamond Healthcare invested in us, and the reason they invested in us was because they believed that there were at the time 2 major things that were going to change mental health, right? Genetics and telehealth, and within telehealth, they basically included digital health. It took COVID, right, for telehealth to actually become interesting for mental health, 15 years later, right? So digital health is hard. It's interesting because, pharmaceuticals and things like that are hard because you might spend 15 years developing it and fail in your phase 3 and blow all that money. But you have a plan. When you go into it, you know how to get to phase 3, right? You can sit down on day 1 and say, this is how long it's going to take. This is what we're going to do, right? And with digital health, we're fighting. I was at the digital therapeutics, a digital therapeutics conference last year when you were still allowed to go talk to people live. And I remember somebody up on stage at one point said, maybe the biggest problem we have right now is that we keep calling ourselves digital therapeutics instead of just saying we're a therapeutic, because people think that we're different and we're not, right? I mean, a therapeutic or a therapy or a treatment, whether it's digital or whether it's talk therapy or whether it's a pill or whether it's a combination of all those things, which is probably the best way to solve any of these problems, are all just therapies. And so they're thought of differently by FDA. They're thought of differently by investors. So there's a more, and it's more, a little bit more kind of blue sea, right? I mean, you don't really know what you have to do to get something approved or how people are going to start using it. And you've got to decide, is it consumer based or clinical based, right? Our product right now, for example, we don't let people download it from the App Store, right? Only doctors can get a hold of it. Although we see a path to where we could get there someday. So I think it's super important. I think it's a little bit harder, although I will say, as somebody who's been building software my whole life, I mean, the nice thing about some of the things we do is that we can, I can go back in time right now and pull all the audio files with IRB approval from John Peshtian's clinical trials 10 years ago, and I can run them through my algorithms and see if I do a better job. You can't take a pill and go back 10 years to a patient and put it in them with a slight change and see if something different happened, right? So it's a different model, but I do think we're moving very much in the right direction. I do think for any of you out there who lobby, whether that's, soft lobby or hard lobby or whatever. I mean, we live in a world right now where, because of COVID, executive orders at the national and state level have changed things. Like in Ohio, it was illegal to have a first mental health visit with a patient through telehealth, and that's suspended. That ends on December 31st. So hopefully it'll at least be extended by executive order, but it needs to be made law, right? And a lot of the cross-state laws around telemedicine are all suspended right now. You look at, we're lucky where we live, and it's still difficult, right? I get calls every day asking me if I can make a call to Linder Center or to Cincinnati Children's or to UC to get a patient in, because it takes 4 to 6 months to get in to see a psychiatrist. South Dakota has 3 adolescent psychiatrists in the entire state. Mm-hmm. And so doing telehealth doesn't do you a lot of good if you can't cross the state border to somewhere where there actually is an adolescent psychiatrist, right? So 60% of the counties in the United States do not have a child psychiatrist, right? So right? So there's a lot of things that are changing, and and I think people are starting to see that digital therapy. The problem is, it's just like in the genetics world 15 years ago, there's a lot of junk out there, right? You can go up to the App Store and probably find 200 self-help mental health apps. So how do you figure out what the right one is, right? Mm-hmm. So we've got to weed all that out and get the ones that actually work in front of people. But other than that, it's a fun space to be in. You can make a difference pretty quick. It doesn't take 20 years to get a product on the market.
Absolutely. Well, and in terms of the digital world, how much it's evolved over the last 10 years. My phone knows my sleep habits, my health habits, my exercise, et cetera. And that data is super rich to get to these researchers and these quality improvement teams in like the Hive communities. So instead of getting the doctor visit data only, you're getting data in between those visits. So if they have a quality improvement project across a patient population to look at the modification of a drug, they can see the day-to-day or week-to-week differences that's going to make in this patient population instead of those specific timeframes, maybe once a month, once every 3 months, once every 9 months. So the digital world, how it's evolved, is making that data that much richer, which is going to speed up innovation and speed up improvement.
I mean, so we have about out of time, but I guess sort of like a last sort of closing thought from each of you. I mean, so what are you most excited about sort of in the digital health space over the next 5 to 10 years? And then what like most terrifies you?
Well, what always terrifies me is the FDA, and I don't mean this in a bad way. FDA is completely underfunded, and so they don't have the resources and expertise to keep up with whatever the newest thing is, right? So they've been struggling a lot with AI in our case. To their credit, they've been putting out a lot of papers recently about how they're thinking about it, but you're talking about an organization that doesn't have enough resources to inspect food, let alone understand machine learning and AI. So I think it worries me both from a standpoint that they might slow things down or that they might just let it wide open, right? Because there's a lot of ability to just say, I have AI and it can tell if you're suicidal. And, a company like ours has almost 20 years of clinical data to show that we can do that. And that's a very different proposition than two guys in a garage going off and just building something, right? So most excited, I don't know, probably the same, because of all that, we can go off and build new things pretty quickly. Yeah. I mean, people are starting to not just understand it, but expect it, right? People do know what Scott just said, right? I mean, people do allow their phone to track what's going on with them. And I think that is nothing but good from like what Scott's just said perspective.
When he said habits, I was more thinking lack of habits in my case. But.
Well, my phone, I don't listen to my phone when it shows me all that stuff, right?
So how about you, Scott? Let's end with your.
I'm a data junkie, so I love my phone and what it tells me. So what scares me? There's two things that scare me: security, cybersecurity. We always have to stay on top of that. I mean, we're dealing with very sensitive data, and we always need to stay on top of it. So anybody in my position or Don's position or anybody at these companies, that should keep you up at night all the time. The other thing is kind of these slow, bureaucratic moving healthcare systems. Adopting newer technology, getting that new technology in these places is tough. And you really have to have a good story, and you have to have proven success to get in the door. So that's definitely concerns of mine. Now, in terms of what excites me, I mean, there's such rapid evolvement in technology nowadays that excites me a lot. And applying Don's technology, our methodology in terms of Hive and improving outcomes and improving quality of care for people, those are the things that excite me. Impacting millions upon millions of people, and with rare and chronic conditions, with mental health, that's what excites me about the digital age, being able to speed up that innovation and making a bigger impact on people. And I like I said earlier, Don and I could talk about this stuff for hours upon hours.
Yes. And unfortunately, we do have another session coming up at 11:50. We're going to have Artie Kuhn in a class from Miami talking about designing a better health app and some projects. I think Don and Scott, if you guys can stick around, you guys probably enjoy that one as well. Marcy has actually spoken to these students with me, Don, a lot. So hopefully see the audience over there. This is recorded, and so you Startup Cincy will be putting on their Facebook if you missed anything. And have a good weekend. And then after, we have one more HealthTech session with the class I mentioned. Then we go into a series on making the leap at 1 o'clock, where we're going to have a session titled "So You Want to Be an Angel Investor." And key for that is probably to have some money. But anyway, I hope to see you guys all there.
Awesome. Thank you.
Thanks, Carl.